The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, Mercy Medical Center, and of course our socially distant technical producer, J.D. DeAngelis. Today, Brad and I are broadcasting from our administrative offices and our special guest, Dr. Garcia, founder and president of Apex Skin. Good morning, Dr. Garcia, and welcome to the show.
Good morning, Paul. Thanks for having me. Hi, Brad.
Morning. Okay, your skin is your protection, and it's the very first line of defense for anything you come into contact with. For this reason, you should be adamant about maintaining its health. Whether it be skin cancer, acne, eczema, or aesthetic concerns, you should never neglect the health of your skin. Today, we're going to talk with Dr. Garcia about Apex Dermatology and their approach to treating skin conditions. We'd like to remind our listeners that you can subscribe to our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and you can take our programs with you anywhere, anytime.
So, Dr. Garcia, welcome again to the show. And tell us a little bit about yourself and introduce yourself to our listeners.
Thank you for the opportunity. Yeah, so my name is Jorge Garcia, Dr. Garcia. I am the founder and president of Apex Dermatology. I'm originally from Puerto Rico, grew up in Caracas, Venezuela, and, I landed in the United States for school, for college. I spent some time in the Marines as a flight surgeon. Moved to Ohio with my family to do dermatology training at University Hospitals Case Western. Did my fellowship in Harvard, Mohs micrographic surgery, and came back to Ohio. This is where we landed. This is home now. And I founded Apex Dermatology in 2011. Really with an idea to bridge the access gap for dermatology patients. There's not a lot of us, and we're trying to help people out as much as we can.
So what services does Apex Dermatology offer, and what sets Apex apart from other dermatologists? So
I always try to tell people that at Apex, we really deliver on our purpose, which is transforming lives through healthy skin. And what I mean by that is that, all of our providers, all of our staff really in general, is really aligning that purpose. And we, whether you're a patient with acne, whether you're a patient with psoriasis or eczema or skin cancer, we really are, delivering an awesome what I call rockstar patient experience, where we, see you right away with no minimal wait time. You're not going to wait 2 hours to wait to see us. You're not going to wait 3 months to see us either. And we're really transforming lives. It's a very powerful purpose when you have somebody that comes in with skin cancer and comes out without that same day, or when you have a clear pathway for clearing somebody's skin. And so that's really what sets us apart. We really deliver on that experience because we treat people like family. And I always tell people, when you come to Apex, you're really a patient for life. I mean, we our patients come back, they bring their family members, because I think they really appreciate our care, and we're very prompt and very good at what we do.
So, I understand you have a new location in Canton. Tell us about that location and the team there.
Yeah, so we're very excited to start in Canton. We started December 7th. I've been trying to go to Canton now for, really since we started Apex. It's always been on our target just because it's such an underserved area. We are it's a brand new facility, 5,000 square feet, office building. Really state of the art. We are in Munson Street. The address is 4124 Munson. And really we're excited to help the community. In Canton, there's a lot of need for dermatologists, and especially skin cancer work. We are very excited to bring the Mohs surgery technique into the Canton market. Right now, there's nobody doing Mohs surgery in Canton. People need to get that, which is, by the way, we'll talk about this later, but Mohs is the gold standard for skin cancer, for the head face. Right now, people have to travel to Cleveland or to Akron or wait months to get treated. Now we're going to have that in our Canton office. In fact, yesterday was our first day doing Mohs in Canton. So it's really terrific for the community, and that's another thing that we differentiate ourselves, that we really partner with the community, and we reach out to the chamber, we reach out to to basically the local primary care doctors and say, hey, we're here to help you and to help your patients. And that's how we've been able to grow and be successful as a group.
So you have another office, is that correct?
Yeah, Canton is our 10th location. We have offices throughout Northeast Ohio. Yep.
I see. So you probably already answered this, but why did you decide to start Apex Dermatology?
When I was working as a faculty member at the Department of Dermatology of UH, and at that time I was very happy with my work. And I became frustrated with patients telling me, "Listen, doc, how come it takes me 3 months to see you?" Or how, So I decided, there's got to be something better. There's got to be a better way. Even though with the healthcare in this, we're lucky that we have really terrific healthcare in this community. I still felt, for dermatology, I think we can do a better job. So I started the practice in Concord, just me and a few people that kind of trusted on my vision. And really, to tackle that, when you call Apex, we guarantee same-day appointments or next-day appointments. We're not going to tell you, oh, yeah, you got a rash, we'll see you in 3 months. That's just not how we roll.
The rash is gone or my body's gone, huh?
Right. I mean, if you got shingles, you got to be seen today.
Yeah,
you wait 3 months. So that's kind of how we did it.
Okay. So do you have have you done other specialties in your prior life or
before I started Apex, I was a flight surgeon for the Marines. So
how long were you in the Marines?
Well, I was active duty for about 5 years, and then I stayed total for about 12 in the reserve. Total of 12 years served, a lot of overseas deployments. And as a flight surgeon, really what I did was I was the medical department head for a fighter squadron based out of South Carolina, BMFA 122. A shout out to them, to the Crusaders. But, really it was a terrific experience early on in my career to develop leadership skills, to really, go out there and be outside of my comfort zone. And listen, my time in the military really formed me to be a better person. And then, listen, I owe a lot to them. So I'm grateful that I was able to have that experience.
Very interesting. Very interesting.
And then, as a flight surgeon, I was just doing general medical stuff, and then I subspecialized in dermatology, and then I did my extra training on the Mohs surgery, which is skin cancer.
So what was your most challenging overseas duty?
Well, we did a lot of overseas stuff. I would say that there's a couple of challenging duty stations, and when we're in the Pacific Theater, some challenging stuff that I had to deal with as a doctor. But listen, I always think back and I say, hey, when you have your brothers and sisters in the military there and you're deployed, you really form a tight bond. And I've been able to continue to pay that forward with the Apex Purple Heart Project, which we can talk about that later. But yeah, it's terrific.
Are you still in the reserve?
No, not anymore.
Okay.
Yeah. Now I'm just in Cleveland.
Okay. Okay.
No more travel.
All right.
All right. So you alluded to this earlier, but for listeners just joining us, it sounds like if you're trying to squeak in a visit to a dermatologist before your deductible resets in January, you might be able to help. Absolutely.
So, like I said, our phone number is 833-279-SKIN. So 833-279-SKIN. We are, like I said, our value proposition is really same-day, next-day appointments. And really what happens is when people call and we offer them, you want to call at 10 o'clock today? They say, like, oh, they're not ready for that. They're not used to that. So, we're changing the model. But absolutely, I always encourage people to, even throughout the pandemic, listen, if you have something in your skin or if you have something that needs to be treated, don't wait. And really, don't go to the ER. The ER right now needs to be focused on COVID. We actually, that's one of the things we did in COVID. We pivoted and reached out to most of the ERs, the urgent care, say, hey, listen, anything that's derm-related, lacerations, psoriasis, send it to us. We can see them. So we were able really to help our colleagues in the front lines unloading some of those patients, because a lot of patients don't know that there's dermatology in the area. So, people with shingles or rashes or cuts go to the ER. They don't know where to go. So definitely, the deductible is a big deal. Usually December, most people the deductibles have been covered, so it's usually a busier time in dermatology, really in general practice, November, December, to be busy because people want to get in to get stuff done. Obviously, with COVID, I think everybody's down in volume, but I highly recommend people that if they have something, definitely give us a call. We'll help you out. And like I said, we're just opening Canton, so we'll definitely have availability today probably, or tomorrow, or, we have the same day availability. So yeah, for sure. One thing that, to touch real quick on this, one thing that I have seen in my practice from COVID is that people, because they're afraid to go into the doctor or to go anywhere, I've seen a lot of these cancers now, within a period of months of left untreated, grow really fast or be more aggressive. So I say to people, hey, if you got something, we're definitely, at Apex, we're definitely prepared to take care of you. We're we're following strict guidelines of cleanliness. We have, obviously, we screen the patients before they come in. We check temperature of our staff and the patients. We have, UVC filters in our waiting rooms that are kind of circulating the air. Listen, if people are going to places to grocery shop and things like that, definitely you can go to the doctor's office because we're taking it the extra step. Obviously, we have PPE everywhere. Everybody's masked. Everybody's got everything that we need to do. And, we really haven't seen an uptick in COVID patients in our staff, on our patients. And we've been open since the whole year. So we're doing the right thing. And I think patients appreciate that we're open. We haven't really given up on them. We're still there. So we're ready to see them.
So, what I hear you saying is you're still letting the patient experience an in-practice visit. Are you leveraging technology to do virtual visits, or are you basically a hands-on practice? We do both. Through the pandemic, and we offer telemedicine visits as well in our website. Our website is apexscan.com. So telemedicine in dermatology can be good, but it could also not be that good, because in dermatology, if you have something, dermatology have to touch that lesion. You got to touch the patient. Obviously for follow-up or, medication follow-up, these things like that, I think for if you have a question about something that we can just take a quick look in telemedicine, we can tell you, hey, yeah, that should be biopsied. But really the message is that it is safe to still go to the doctor. Obviously, we have the telemedicine health platform kind of through our website, and that works too. But for the most part, most of our patients are coming back, and they kind of need that. We have a lot of chronic patients with a lot of skin diseases that they really need to see us, not just to the computer, but really, in the office.
Okay, Doctor, our first break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for staff care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia. You know us. We're the Half Off on Hot Buy store in Louisville. The Half Off on Hot Buy store in Louisville next to the Medicine Center Pharmacy. And we'd like to wish you all a Merry, Merry Christmas and a very Happy New Year.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing skin cancer with Dr. Garcia from Apex Skin.
All right, so let's talk about skin cancer. As someone who has had that myself, this is a serious matter, and I'm sure, Doctor, that you have some comments on some factors that put you more at risk and some best practices. So by all means, if you could share your knowledge, I think it'd be valuable for our community.
Yes, of course. So this is what I always tell people about skin cancer. Some statistics out there. 1 in 5 Americans will have skin cancer during their lifetime. So, it's very prevalent in our community. What are the risk factors for skin cancers? Well, if you're Caucasian, if you have, blonde hair, blue-eyed, if you have a family history of skin cancer, and melanoma, for example, if you have outside work exposure, your profession requires you to be outside, or you're very, an outdoors person, and if you've had a lot of blistering summers as a child, that's another risk factor. If you used indoor tanning, early in your life. What to look for, right? So, I always tell people skin cancer can look like a pimple. So there's different types of skin cancer. We look at the top 3: basal cell cancer, squamous cell cancer, or melanoma. Basal cell will look like a little pimple that doesn't go away. It looks like a little crusty thing that, you flick in your face and then comes back next week or next month. People always say, it looked like a little pimple. I thought it was a bug bite. So that's something that, if you're something, we always tell people, you have a spot that doesn't heal, within 3 to 4 weeks, get it checked. Squamous cell looks more warty, more crusty. Those are usually, again, most of these things in head and neck areas where you have sun exposure. Melanoma is a little bit of a different animal. It looks like a beauty mark, like a brown spot. And a lot of times it doesn't hurt or doesn't have any symptoms. So, I always tell people, on your birthday, check your birthday suit, right? So that's a reminder of people. Listen, come to see the dermatologist once a year. It's important we're trained to see what we need to see on the body and the skin. That's what we do for a living. Oftentimes what happens, people come into our office because they have a question about one spot, and then we end up saying, no, that's fine. Let me check this other spot. So, be skin smart, I tell people. You see something that doesn't look right, or is changing, get it checked. The last thing I want to say is that we have a very cool mnemonic that we teach people about melanoma. It's called A, B, C, D, E of melanoma. A is for asymmetry. So anything that doesn't look, symmetrical, equal in both sides, if you split it right down the middle. B is borders, irregular borders within a mole, jaggedy edges. C is color. If you have different colors within a mole, black, different shades of gray or blue or something like that, something that looks funny. D is diameter. Anything bigger than a pencil eraser probably should be evaluated by us. E is evolving. So if you have something that's changing, but by changing I means getting bigger, getting smaller, getting crusty, now it's painful, it's bleeding, anything that looks funny or that starts to get irritating or has some type of symptoms, those are, kind of quick guideline to check your skin. And if you have anything like that, it's probably a good idea to have it checked. And, I can tell you how we do it when we talk about it. But, it's the skin check evaluation is a very easy, non-invasive evaluation. So you don't have to be afraid of, they're going to probe me everywhere. No, we're not. It's just a visual inspection of your skin.
Why do we get skin cancers?
Well, a lot of times people get skin cancer. A lot of times it's because of genetics and because of your heritage. If you're one of those people that have really light skin and you've been out in the sun, what happens is that throughout your life you've been in the sun, even though you're not in the beach. You are in the sun when you drive, when you do stuff, when you go to the mall. So our checkpoints, our DNA kind of mutation, kind of repair and molecules and cells, our checkpoints, so to speak, over time they fail, and then some people develop these skin cancers. Obviously, a lot of people out there are taking immunosuppressant medications. Let's say you have lupus or psoriasis, or you have a history of lymphoma, or you have a transplant. If you're an organ transplant patient, that's one of my research interests, for example. All those people, to survive, need to take medications that lower their immune system. Well, automatically you're at risk of skin cancer. So those people, we always recommend getting checked twice a year, just like those are the guidelines for skin cancer. If you've had basal cell or squamous, you should be seen twice a year by a derm. If you've had melanoma, you should be seen every 4 months or so. We keep a closer, tight eye on this. But usually it's a combination of factors. It's not one thing. And by the way, you don't have to, anybody can get skin cancer. So it's not just the white people, right? So we have Hispanic, the African-American, Caribbean population. What's interesting in those populations is that they think that they can't get it because they have a little bit of a protection. But what happens is that when they show up to see us, the cancer is a lot more invasive or aggressive, or in a more aggressive stage, because they came in later, because there's a misconception. Hey, if I'm darker skinned, if I have a little more tan look, I don't get it. So I always tell people, Bob Marley, you guys, familiar with his music, but he died of melanoma of the nail. So, melanoma can happen anywhere, not just in your face or your back, but, it could be in the back of your mouth, it could be in your brain. That's why we always tell people, hey, let's check your skin and be proactive about it. So if you get something in your nail that doesn't look quite right, get it checked.
Gosh, that's amazing. Okay. All right, I think we better take a break here. It's about an hour time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for staff care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
It's a winter wonderland at Studio Arts and Glass. Our annual holiday open house now through Thanksgiving. Take 20% off your entire order. Hand-blown glass ornaments, your Santas, jewelry, come make a wreath or a glass snowflake. 20% off your entire order. See our extended holiday hours at studioartsandglass.com. Shop local this holiday season.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out Buy store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
Your severe weather station, News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing healthy skin and skin care with Dr. Garcia from Apex Skin. We've got a lot more to cover this morning, so let's get back to the show.
All right, doctor, why don't we talk about what a skin cancer screening is like from the patient's point of view?
Perfect. So you come into the office, there's a paperwork they got to fill out. And then, really it's we give you a gown. Usually we call it a total body exam. Really, it's a visual inspection of your skin. We give you a gown. We don't, we keep it all obviously decent, and we look at your scalp, we look at your face, we look at your back of your legs. Make sure that we're looking for suspicious lesions. Like I said, sometimes we touch a little bit of the face to see. A lot of times these lesions you can feel rather than you can see. So we look for those things, and really we just ask you some general questions. It's really not a probing exam. It's very easy on the patient. Now, if let's say we suspect something that it looks funny, like a funny mole, then the next step is to do a small biopsy. A small biopsy is a very simple procedure. It's covered by insurance. And what we do is we numb the area lightly with a little local medicine. It's like a tiny little injection. And then we use a little instrument. It looks like a little scraper. We just scrape it off. It's like a scrape. Really, it's like a deeper scrape with your fingernail. Then we'll put a little bandage, Vaseline, a bandage or something, and then out you go. We take that tissue, and then that tissue gets processed in the lab, and they tell us the diagnosis. So the skin biopsy is really not a very invasive procedure. I would say most people, when they come in, and we're also very efficient. So I would say a skin check, done by us. It's not an hour procedure either. It's a 10-minute procedure, and we want to get to know you a little bit, ask you about risk factors, and then that's it. It's really simple, and it's something that we do every day. Yep.
I got to ask you this: what's a keratosis?
Keratosis.
Yes.
Well, there's two types, right? So there's the seborrheic keratosis, which are usually the one that bring you in because they're brown, stuck on, looks like barnacles out. A lot of people get those. Those are benign. Those are things that people grow as they get older. I always tell people, as we get older, just like our hair turns white and some people lose their hair like I do, well, your skin gets older. So, you're going to grow things. Some people grow these keratosis that are brown, they look funny. Actinic keratosis, however, they're precancers. Those are the ones that are flaky and dry, usually in the head or the scalp. They're rough and scaly. And those are 10% of those will develop into skin cancers. Those are the ones that we freeze. So if you ever been to a dermatologist, we use a little container of liquid nitrogen, and we freeze a lot of these things. Mm-hmm. The reason we freeze them is to get rid of them. That's how we treat the keratosis or the actinic keratosis. Usually they go away. I always tell people, if you have something that has been frozen once or twice and still there, then we need to biopsy that because it's something that is telling us, hey, there's something deeper here that's resisting the treatment. So that's usually what we do. We freeze, and then if it doesn't go away, we biopsy. Sometimes we just have to biopsy because it's obvious that it's heat cancer. So, but seborrheic keratosis are benign.
I've lost the term for this. I've seen people with like outgrowths that almost look like a nipple, if you will. I can't remember the term for that. Why do we get those?
Yeah, we have obviously skin tags. We have cutaneous horns that people get. I mean, again, this is all extrinsic aging of the skin. Very common to have around the neck or the armpits. That completely benign. We don't really remove them unless they're symptomatic, with people. Mm-hmm. A lot of people come in just to get them off because they really bother their chain or something.
Yeah.
But this is nothing to worry about in general. Yep.
Okay, we were talking about skin cancer screenings. How often should we do that?
Once a year. Once a year it's appropriate unless you've had skin cancer, and then we recommend those twice a year. It's something that's covered by insurance. And the biopsies is covered by insurance. So, I think it's, be proactive and get your skin checked if you have something.
I had a keratosis on my back, and so I went to this surgeon, and he said, if I take it off, you're going to have a heck of a hole in your back, and it's in an area where I can't reach it to itch it, whatever, that sort of thing. So,
right.
so is the liquid nitrogen thing the real deal for most of the?
Yeah, I think the liquid nitrogen helps for keratosis. Sometimes we just have to shave them off, honestly, but they come back sometimes, right? So if you're one of those people that have a big one that's really irritating your back when you sit down or something, that's simple to remove. Like I said, we just shave it off, and then it's off of your body. I tell you, there's a very, very, very small percentage of people that have melanoma that mimics a seborrheic keratosis. So anytime we send something, anytime we take something off of the body, we'll send it for testing. Because you'll get that one patient every 50 years that seborrheic keratosis had a melanoma underneath. We see that too in tattoos. A lot of people have tattoos these days. Sometimes the tattoos cover moles, and we've had a couple of melanomas in a tattoo. So those are tricky, and we have to be vigilant. And again, tattoos sometimes complicate things from the skin side.
Well, I always thought of a tattoo as there's enough pain in life without getting a tattoo. And I'm thinking, I think obviously they're very popular, and there's a lot of people that have them all over their body. Well, how complicated does that make a skin exam?
It's hard. It's really hard, man. So, like I said, we when we have tattoos, especially with the whole sleeve, it's tricky to see a mole there.
Yeah,
so sometimes tattoos can hide things. It's happening in my career that we found something that looks funny within a tattoo when it's a melanoma. So be careful when you get that tattoo. Don't get it all covered. Give us some space like this.
I guess the other thing I heard about these people with all these tattoos all over the place, that the ink is toxic when you get to the point that you have so many so many tattoos all over the body, and I'm thinking, gosh, it's crazy.
Sometimes what we see from the dermatology side, sometimes some people, not that very common, but it happens. Some people are allergic to certain dyes of the tattoos. So black, I always tell people, if you're going to get a tattoo initially, blue, black are relatively safe, and they're also the easiest one to remove. If you ever want to remove with laser, that's the easier way. If you go start yellow and, red and violet and purple, those are more allergenic. And some people, you don't know if you have an allergy until you get a tattoo. So it gets tricky sometimes with those special colors. And also they're really hard to remove. By the way, this is a good segue for just other things that we do at Apex is aesthetics. So, a lot of people these days, they want to do Botox or little fillers or chemical peels or things, especially if you have a good event coming up, a special event. I suspect in 2021, all these things that were postponed this year, these events are going to all happen, I hope, in 2021. So, we do a lot of that. We're very good about giving you a skincare regimen that you start using and give you some advice, professional advice on what to use. We're not in the business of giving you, buy this $200 cream. That's not how we roll. We want to make sure that you're happy with the regimen, but we have stuff to do. We do everything that's aesthetics within dermatology. We don't do liposuction. We don't do, nose jobs. But we do laser rejuvenation and things like that. And there's a lot of things these days that you can do for your skin that is non-surgical and that works really well. And if you're preventing that, preventing some of the signs of aging. That's very, people are very proactive these days, and it doesn't break the bank anymore. It used to be really expensive. Now it's really affordable.
Well, okay, so what's a wound look like after you laser a tattoo off, or isn't there a wound?
Yeah, well, tattoo removal is a special laser, obviously, for pigmented tattoos, and it's a series of treatment. It's not just one and done like the tattoo. So it's multiple treatments, and usually over time, the laser basically targets the pigment inside the skin, and over time, the tattoo pigment gets reabsorbed by the body. So it's a fading effect. It's never going to look perfect, like you never had anything, but it's close, So for those people that have black-blue tattoos, it's close. If you got a red and purple, the black and blue will go away, but the red and purple probably will stay there. It's just harder to take. Right now, it's kind of a cool thing that they're actually working in technology that develop tattoo that's ink that's removable. So that's something that's coming in the future because tattoos are so popular that that now some of the scientists are working on that to say, hey, that way 20 years from now when you don't want that tattoo, maybe we can remove it with special technology. And I always tell people the kiss of death is when you have your boyfriend or don't tattoo their boyfriend.
Yeah, your name, yeah.
So what happens usually the next week, I need you to take these off, Doc. So be careful, all right?
Yeah, get rid of this. So, okay, we got 3 or 4 layers of skin. Where's the tattoo ink go? Under what layer?
Usually right below the epidermis, right? It's in we call it the dermis. That's where it goes.
Okay, thus it's able to be lasered off to some extent.
Yeah, that's why the lasers get to the layer where it needs to be, for sure. Yeah.
Okay. Go ahead, Brad.
All right, Doctor. Well, we were going to touch on COVID precautions, but you already really touched on those. What about you mentioned earlier in the program the procedure for Mohs surgery? Is that the right way to pronounce that?
Yep.
And can you talk a little bit about that and help our listeners understand why that's such an asset to have right here in our community?
Yeah, for sure. So Mohs micrographic surgery is really the gold standard for removal of basal cells, squamous cells in the body. The way it works, it's all done under local anesthesia in our office. We numb the area. We take the little piece around the area of the skin cancer, and we check it in our lab while you wait. We have a process that, we do turn around 10, 15 minutes, and then the Mohs surgeon is trained to look under the microscope, those slides, and then we can see whether the cancer is out or not. We examine the periphery of the tumor and the deep edge under the microscope. And if we still see cancer somewhere deep or something, we go back to the patient 15 minutes later. Hey, I got to get a little bit more here. So it's a layer-by-layer approach. And the whole point of Mohs is really to conserve as much skin as possible, but at the same time removing all the cancer. So it's really a perfect treatment for the face or the nose or the ears. Obviously, we use it on the trunk, too, for big cancers. We do it that way, too, to make sure we get it all out. Some of these cancers go deep. You'd be surprised how many times you see something that almost looks like nothing in the forehead, and by the time you're done, this thing is the size of a dime or a quarter. So it's a really sophisticated technique. We've done all in the office. And listen, we're very excited to start doing that in Canton because, for those patients that I'm sure people are listening right now, some patients will say, yeah, I have to travel an hour to get this done. It took me a month. And listen, when you're a cancer patient, that C word, it's very powerful, and people get stressed out. People get depressed. So our job is really, hey, let's get this cancer off of you so you can get back into the game, get back into the life that you have. And with Mohs, it's 99% curative. So I would say, 1% of people will have a recurrence after a Mohs surgery. Again, in my line of work, I see sometimes as 1%, right? Because that's what I do for a living. But 98% odds, you take those any day. Versus the 50% odds. So I always tell people, when you treat the cancer, for any type of cancer, experience is what matters. And at Apex, we have me, and we have Dr. Patrick Killian, who is covering Canton. Over him and I, we probably have over 50,000 Mohs procedures that we've done. And we feel very comfortable treating you, and it's a very easy on the patient procedure. You'll be surprised. People come in and say, wow, doc, this wasn't bad at all. The other advantage of Mohs surgery is that we also do the reconstruction as we do it, the same day usually. So if you have a little bit of a hole after the cancer, we can do the reconstructive technique. We don't have to send you somewhere else. Sometimes we do. They're really big cancers. Sometimes we work with our colleagues, plastic surgeons, with the ENT. I mean, we're part of their management team. But I would say for the most part, most people we can treat. The whole process is maybe an hour and a half, and you're in and out the door. And we're very efficient with what we do. And like I said, if you go to a place that only does oil change, you're going to get an oil change doing real well. Well, if you come to Apex for skin cancer, you're going to really have a terrific experience, and we're very excited to have that in Canton now.
Okay, Doctor, our final break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. You know us. We're the half-off and hot buy store in Louisville. Our Christmas treat to you is 50% off of our already half-off Christmas seasonal merchandise. Our lighted Christmas pictures are a knockout, and we have a huge inventory. Don't miss this sale. The half-off and hot buy store in Louisville next to the Medicine Center Pharmacy. See us on Facebook and check our website, halfoffhotbuy.com. And we'd like to wish you all a Merry, Merry Christmas and a very Happy New Year. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
So welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us, and we're talking with Dr. Garcia from Apex Skin today.
I understand you've got a skincare line at your practice, so why don't you touch on that?
Sure. We have what we call a private label Apex Skin line. It's something that I've been working now for a couple of years now in terms of, what products can we offer our patients that, are good for the budget, but also that are, clinically proven, science, backed by science. So, we have, obviously, acne is a very big part of what we do, and we have a little acne kit for a lot of people that's pretty affordable. It works really well. We also have, obviously, what we call the Apex Essentials, which are basically, hey, if you're over 30 and you want to take care of your skin, you need sunscreen, you need the essentials, right? You need retinol, you need a good cleanser. So we have the small packages that I think are really good, are made by professional pharmaceutical companies. It's not like I'm doing it in my basement. These are basically, products that work for the skin. We just have a selected products that we've done. We have something for eczema. We have a few things for moisturizers and things like that. Just to add value. Listen, I always think that if we can add value to our visit, that's what we do. So, if I can save you, half hour to go to a store to get shampoo, and I have it in my office because we have it because it's medicated, hey, take it here. So it's something that just trying to add value in this day and age that, people we value your time. And just like we do telemedicine or just like we do electronic prescriptions, we can save you time of your busy schedule. Hey, that's how we're all about. But it's a really good line. We're very excited. And it's all in our website. People can buy it online. It's a really cool starting line for us, which we're very excited about. We can also, if you want to, I can talk about. I'm very passionate about the Purple Heart Project. We touched briefly on that. So I wanted, over the last, 3 years, I've been thinking about a community service that I wanted to use my passion for dermatology and my military service as a flight doc. So, we created a Paper Heart Project, which is basically a program where Apex provides complimentary laser scar revisions for wounded veterans. So we have a process where, you can go to our website, it's right there, apexskin.com. If you're a vet, if you've been wounded in battle, hey, go in there. We may be able to help you. For me, the most important thing about this project is that if I can help one person, even if it's one person per year, get back into the game of life. There's, as you know, a lot of vets, suffer a lot of wounds. There's a lot of PTSD out there, some mental health awareness that we need to. If I can help out in my capacity, that's what makes me proud of being part of Apex team. So, we have this program, and like I said, we try to, not every scars can be treated with laser, but we try to, it's free. So we try to evaluate the vet, give them our recommendation for the things. If we can help, we'll do it free of charge, which is awesome. And that's another way we really contribute to the community. We, as we partnered with the communities where in this month with COVID, this year in December with the holidays, we're trying to help families in need. We contributed with St. Jude's medical home here locally. We're really out there trying to, as much as we can, do our part to help families in need in this time of the pandemic. And I know each our locations have a special charity that they're working on. This year we cannot get together as a whole team this year for our holidays. We have every office doing some community work supporting a charity of their choice, so we can make it our difference. That's our token that we can do from our side, and that's how we've been always been at Apex, trying to really reach out to the community and be there to help. ApexSkin.com. There's a little icon there that says Purple Heart. I'm not going to repeat what I said, 5 minutes ago, but I would say that it's a great project to help our vets that have been wounded, and we are offering that service complimentary to them. So all the information is in our website, and it really makes me proud to be part of that.
So we're very close to the end of the show. Maybe you can give us your contacts again, Doctor.
Yeah, so anybody out there listening that really wants to learn about our practice, our phone number is really easy, 833-279-SKIN, 833-279-SKIN. Our website is apexskin.com. We are open, like I said, in Canton, 4124 Munson Street. That's our website. That's our address. It's all in our website. There's the picture there. In our website, really, we have wealth of information on aesthetics and the Purple Heart Project, all our providers. You'll see that all our providers are terrific. We have great backgrounds in medicine. And I want to, let you know that we're now in Canton and we're happy to be in the community. We hope we can help you with the most procedures, with skin checks, with anything that you need from the skin side. We're going to be your helper. So give us, if you need a dermatologist, come see us. If you have had skin cancer, haven't get it checked for a while, come see us. We're open. We can see you next week easily. And I thank you guys for the opportunity for this webcast. It's terrific. And I hope I was able to provide some information that was helpful to your viewers.
Very interesting, Doctor.
Thank you.
Dr. Jorge.
Garcia-Zuazaga.
Thank you very much, Doctor. Founder and president of Apex Skin. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, a happy and a Merry Christmas and a Happy New Year, and have a healthy holiday. We'll see you right here next week on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's MEDSHOPRX.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.
Let's enjoy a simpler holiday life this year. Family, friends, and loved ones.
It's been such a crazy year. Here's to a nice, calm, and happy holiday season.
Here's wishing you and yours the very happiest of holiday seasons and only the best to come.
Merry Christmas and Happy New Year, everyone. I'm Miracle Walker.
Hi, I'm Rich Nemick from the WHBC Engineering Department.
I'm Ariel Staylor, 1480 WHBC.
I'm Dale from WHBC's Engineering Team. From my family to yours, Merry Christmas.
Chris Cagini with the Stark County Health Department.
Good morning, Tim. Everyone needs to stay at home, wear their masks. If they have to go out, wash their hands frequently throughout the day, keep that social distance, and you just have to say no to gathering. Everybody is on the front line.